Good afternoon, everyone. As we're getting ourselves. Oh boy, we're making it through. We're making it through. But thank you all so much for being here with us this afternoon. We really wanted to give you and provide you with an update as it relates to where we stand in our city, the city of New Orleans. We will be joined, and I'm joined by, of course, our Dr. Avegno, our Director of Health. We have Colin Arnold, who is our Director of Homeland Security, and representing our New Orleans City Council is our Council President, Helena Moreno. You're going to hear from all of us throughout, and you know how we go keep it moving, and I'll come back and forth. But where we currently stand right now is 5,242 positive cases in the city of New Orleans with 224 deaths. I want to thank all of our residents and all of our businesses for just doing their part. Residents staying at home is working. The data tells us it's working. This is not the time for us to let up. We need to continue to follow the stay-at-home mandate so that we can continue, one, as we've started to see our curve. There's been a lot of talk about the curve is flattening. But I want you to know, we see the curve. The stay-at-home mandate is working, but we're not flattening. We're moving in the right direction. And if we continue the course to stay at home, then we know without a doubt we will flatten, we will be a healthier community, and we will move and shift and pivot towards recovery sooner rather than later. But it is all dependent upon you, the residents, who have been listening, and we thank you for that. As we know, this is Passover, it's Holy Thursday, Good Friday tomorrow, Easter Sunday. This is a big, big time in the city of New Orleans for us culturally, even as it relates to celebrating the rebirth and the resurrection of our Lord and Savior, Jesus Christ. But again, we need you to stay at home, follow our mandates because they are working, and do not use this weekend as an opportunity to break the rules. Please do not, because everything that we've gained, all the things in terms of progress, could be turned back around very quickly. So the reason we've made these gains is because people are following the rules, they're staying at home. I also want to thank our business community for continuing to provide essential services to our residents. And more importantly, I want to continue to thank our healthcare professionals and our first responders who continue to be on that front line. And it's because of the real care that you're providing that we're seeing our people coming off of ventilators faster. More people are living. But at the same time, our focus has to remain on saving lives. So while we've seen the death rate increase, we're now at 224. With the type of care that our people are giving and the focus that we're providing, we want to see a limit in those deaths moving forward. There's also been a lot of talk locally, but also nationally, as it relates to the impact disproportionately among African Americans in our city, in the state, and really on a national level as it relates to the outcomes and how we've been impacted by this virus. And what it clearly shows and what we're witnessing is the intersection and impact of multiple things, whether it's race, gender, income inequality, the health disparities that we know exist in terms of chronic illness that continues to plague the African American community, making up that large portion of disparities in our city, the environmental, racism that we've seen just countlessly, and also the inefficient health maintenance. And this speaks to our community, to our people, going to the doctor and getting the health care that they need and also that they deserve. But what we're witnessing are all of these things in terms of the intersecting and the impact that it's having on our people due to this virus. It's having a ferocious impact. And so with that, make no mistake about it, the city of New Orleans has been very much focused on the health disparities in our community. And quite frankly, we doubled down on our efforts in that post-Katrina environment, where we have seen more medical clinics in our communities throughout the city, where we've seen more investment as relates to even obesity, that we're seeing chronic illness. It's the reason why we went smoke-free as a community. Again, being focused on the health outcomes and disparities of our people so that we can be a healthier community. But at the same time, and as we're experiencing this virus and the impact that it's having on our African American community, we're also being very intentional about going to where our people are as it relates to doing more testing, again, being more intentional about where we go, looking at those disparity gaps as it relates to testing to make sure that we are not missing anyone. But Dr. Vegno, who will follow me, will tell you we're doing more testing in the city of New Orleans than we're seeing in the United States of America, and we're really continuing to be second to Iceland as it relates to testing. But we need to know the real impact of community spread to ensure that we have a recovery that we can all be proud of. In addition, I just want to touch on this, and I'm going to move on out and bring up Dr. Vegno, and I'll come back. A part of what we have shared over the past couple of weeks has been the financial impact to the city of New Orleans as it relates to our deficit, and looking very closely and monitoring and forecasting every single day as it relates to our income, meaning our cost burden that we're having, and how we need to not only focus on it, but as it relates to having a better understanding of the federal aid that will be coming our way. As we've taken a deeper dive into the CARES Act, we do have some concerns, I have to say. We need to make sure that we keep red tape out of it. Keep it to a bare minimum. We want money, and money needs to move very quickly to places that have been most impacted by this virus. And the city of New Orleans is one, the fourth in the nation, where we have seen we're ground zero. Second in deaths per 100,000 people. So with that, we're going to make sure, and we have to make sure, that the city of New Orleans gets her fair share as it relates to the federal flow of dollars from the federal government to the state of Louisiana to the city of New Orleans. And let me tell you, even though we do not hit that 500,000 threshold, right, because that's been the threshold that the federal government is using to determine communities that get their federal dollars directly. Because we don't meet that threshold, we therefore will receive resources being funneled through the state of Louisiana. 29% of the cases in Louisiana and 31% of the fatalities right here. Our losses will be over $150 million and growing. We know that our residents were right at 400,000, a little above 400,000, but we serve, when you think about it, and as you've heard me say this long time, 18 million visitors hit the city of New Orleans as we've experienced every single year. So with that, it just has been an added burden to our population. So we're not just 400,000 the way that we're looking at it. But local governments need to be able to provide essential services, as well as we need direct federal support. So you'll hear more from me on this issue. We're not going to let up. We're going to be relentless in ensuring that the city of New Orleans gets her fair share based on this city being ground zero for this virus. The need is urgent, and the city of New Orleans, let me tell you, we will flatten as it relates to the line, but without immediate assistance and meeting our people where they are, it puts us, the burden back on the city of New Orleans. So with that, I'm going to turn it over to Dr. Jennifer Vegno to speak to you more about where we are and where we're going, and then bring up Colin. We'll hear more from our council member, and I'll be back. So with that, Dr. Vegno.
Thank you, Madam Mayor. Thanks, everybody. I want to reiterate what the mayor's saying and begin by saying we are nowhere near the end of this crisis. That said, we do believe we are beginning to see signs that our stay-at-home order, which has been in place for almost 4 weeks, is working. We're seeing a steady pace of cases, which we believe will tell us that the infection rate is slowing. However, hospitalizations and deaths are still on the rise, and we expect them to increase for some time. Our local hospitals are holding steady, but they are in the fight of their lives. So it is more important now than ever that you continue to stay home. We cannot let our guard down, because that could bring us back to square one very, very quickly. Remember that the stay-at-home order has been extended through at least the end of the month. And while we hope to see new cases slow very soon, some of our neighbors, in terms of parishes and states, are days to weeks behind us. We are going to all be in this for some time. I just want to offer my personal thanks and the thanks of our team to everyone who is truly heeding our warning and staying home. Please be patient. Please keep it up. One thing that has been highlighted in recent days is that this disease is disproportionately affecting our African American community in New Orleans. That's due to many factors: underlying health conditions, access to health care, poverty, racism, and more. And these are factors that we call the social determinants of health. Even before COVID, we've spoken up about the generations of inequities that have plagued our community, and about the need for real, lasting structural changes to address this unacceptable reality. So as we close down our federal pilot drive-through testing, which Colin will detail in a moment, we are committed and will continue to ensure that testing is available to the communities that are hardest hit, to our most vulnerable communities and our communities of color. We are actively working with local healthcare institutions to set up mobile testing that will help us bring tests to communities that are being impacted the most by severe illness and death. We will bring it to you. There's going to be more to come on this in the next couple of days. The medical monitoring station at the convention center is up and running. There are several dozen COVID patients now getting 24/7 care as they recover. Again, this is a facility that's designed to take the strain off of hospital resources and serve as a step-down care center for non-fragile patients. The state very rapidly has expanded its criteria even further to accept patients referred by physicians and from other regions of the state, in addition to local hospitals. So what that means is that if you're COVID positive and stable, but you're worried about infecting your family members, you can talk to your doctor about whether going to recuperate at the medical monitoring station at the convention center is a good idea for you. If you've seen the video and the pictures of it, it is an incredibly impressive facility. It is really probably the best facility. If you look at the other ones that have been stood up around the country, this is absolutely the best. It's got private rooms, private bathrooms, 24/7 bedside care, 3 meals a day, and a safe place to be monitored and to recuperate. I'm also excited to announce a new initiative today called SODAT NOLA, and SO is S-E-W, like sewing with thread. As we said last week, we encourage residents and our essential workers in places like grocery stores, pharmacies, banks, everything that has to be open in order for us to continue. We recommended that everyone should wear face coverings while doing their essential activities, whether they're shopping or working. Our cultural community, in partnership with City Council and private industry, has launched SODAT NOLA. SODAT will collect homemade face coverings from donors and match them with requests from our essential workers. This helps ensure that these essential workers are protected while they do the work that helps keep the rest of us safe during this crisis. Again, this is not our healthcare worker community. These are face coverings for everyone else who is ensuring that we have what we need to survive. So if you're a sewer and you'd like to contribute, or if you're an essential worker and would like to request face coverings, go to SODAT.com, SEWDAT.com. The website's up and running. The program should be ready to take donations and connect with workers early next week. If you can afford to buy face coverings for yourself, if you're a member of the general public, and you want to support our local economy at this critical time, there's going to be some really great options out there, handmade by our Mardi Gras Indians, artists, and other culture bearers. We really have the most creative community in the world. We invented face coverings, and they're stepping up now with crafts that make a difference. So we thank them, and we thank you for continuing to abide by the stay-at-home guidance. Thank you.
Thank you, Dr. Begno, and we'll keep the updates coming. Now we'll hear from our Director of Homeland Security, Colin Arnold. He and his team they've just been doing a phenomenal job of managing us through this crisis, standing up our warehouse at the Smoothie King Center. That's very effective, and I cannot say enough about Colin and his leadership. So Colin.
Good afternoon, everybody. So today we're announcing that the drive-through testing program in Orleans Parish will end after a last full day of testing tomorrow. I am really proud that New Orleans was able to be one of a handful of cities that ran this federally supported pilot program, also with our partners in the state of Louisiana and the Louisiana National Guard in particular, and Air National Guard. Through the program, we've tested about 13,000 people in the region, which greatly contributed to the fact that we have about the highest amount of COVID testing per capita in the country. 6% of New Orleanians have been tested for COVID, and that's an astounding number. This program allowed us to offer easy and accessible options for our residents to get tested, while also taking the strain off of hospitals and clinics during the critical early days of the pandemic. We've agreed with our partners at the state that drive-through testing program will now move to other parishes, our neighbors and friends, ramp up their testing. I want to be clear though, there's still plenty of options for Orleans residents to access free testing moving forward. In Jefferson Parish, the Alario Center is going to remain open and for all metro area residents to be tested in that drive-through program. There are numerous other clinics and facilities in the city that continue to offer COVID-19 testing. And we're working with the healthcare industry through our health department and Dr. Abegno to set up mobile testing programs to bring them to communities in need. During the last few weeks, we've heard from many businesses asking to be allowed to reopen. I want to take this opportunity to reiterate what you've heard already and remind everyone that we are under a stay-at-home order at least through the end of this month. And if your business is not essential, you need to remain closed. I'll reiterate again the importance of staying home right now. This weekend will be interesting. It's usually a very celebratory time in our city, but Easter has to be different this year. Please do not host family gatherings, picnics, or Easter egg hunts. It's just too dangerous to risk a spike in infections right now when we're doing well. New Orleans Police Department will enforce stay home and the stay home order and bans on gatherings. You can call 311 to report illegal gatherings. We've already lost over 200 people in our community. These are our friends, they're our neighbors, they're our loved ones. We have to continue to do this and stay strong. There's been some optimistic talk lately, and we're a nation and a city of optimists, but it's time to be realistic. We're in this at least through the end of the month, and we have to continue that. And I'm begging the public to do that. The sacrifices you make today and the sacrifices you make this weekend and in the coming weeks will save lives. Thank you.
Listen, I know we've kind of grown to be a people or a community of wanting instant gratification. And during this time, it's something that it's a big sacrifice that we're all making, but it's worth it because you all are worth it. It has been just an honor to work with the New Orleans City Council through this crisis, who have been partners with the administration as we work through our cash flow issues, our budget issues, deficits coming forward, and even as we pivot to recovery. I just want to thank the leadership of the New Orleans City Council, and I'll ask our Council President, Helena Moreno, to come forth at this time. Councilwoman.
Thank you, ma'am. Well, on behalf of the New Orleans City Council, we very much thank you, Mayor, and your entire team for the tremendous leadership that you have been showing throughout this very difficult crisis. And while it is true that we do have some tough times ahead, particularly with the city budget and our overall recovery, we are all in this together. The City Council stands firmly ready to assist you. That's right. The City Council also, of course, very much wants to thank those essential workers, those healthcare workers. To the healthcare workers out there, yes, you are absolutely saving lives, but let me just also explain a little bit more about how your bedside manner at the end of the day is making such a difference. Not only here in New Orleans, but really across the state of Louisiana. My friend, State Representative Ted James, who I served with in the legislature, he became very ill with COVID-19 and ended up at the hospital in Baton Rouge. He had gotten to the point in his illness where he felt that he no longer had any fighting. And we all have to remember that at this time, there are no visitors allowed in hospitals. So that loved one that ordinarily would be able to give you that support isn't there. But it was the nurses who encouraged him to keep pushing and to keep fighting. And he says it is because of their encouragement and support that he is alive today. So that is how important the work that you're doing is. So we will forever be grateful for the work that you're doing during this crisis, the nurses and all of the healthcare workers. We, the council, also want to thank the essential workers who are helping to keep services running in our city, from our banks to our grocery stores. Thank you so much, especially to our grocery stores. We know that demand is high in our pharmacies as well. And so we know that this has been difficult for you, but we truly thank you for all that you're doing. And finally, of course, we want to thank the people of New Orleans for doing the right thing, for taking the precautions, for staying home, because it is making a difference. But as you heard, we still have to continue to keep our foot on the gas. This is not the time to ease up. Let's face it, we all know people who have become very ill with COVID-19, and unfortunately, many of us also know people who have lost their lives to this virus. This virus is a killer, and the only way that we're going to be able to continue to save lives is if people continue to stay home. So for those of you who may be at this time, maybe somewhat considering maybe having some type of gathering, whether it's for Passover or for Easter, I want you to think about this. Think about the fact that maybe if you have this gathering, someone who shows up ends up getting you or others in your family very sick with COVID-19. Think about the fact that maybe if you have this gathering, that someone who ends up at your gathering catches COVID-19 and then ends up losing their life. It is just not worth it. Please, please continue to stay home. Today, I also want to go ahead and give an update on what's happening with the New Orleans City Council. Of course, we're also continuing our social distancing measures. So the council meeting has now put in place a process for upcoming council meetings, and those meetings will be online. So these are going to be virtual council meetings. The next regular council meeting will be held Wednesday, April 15th at 10 in the morning. Once again, this is an online meeting. The council chamber will be closed to the public. So here's how it's going to work. So myself as council president will be in council chambers working from my iPad, and I'll be joined by the clerk of the council and also the council chief of staff. Those will be the only people in the council chamber. The other council members, they will be working remotely also on whatever electronic device, either from their offices on the second floor, or they'll be working from home. So I want to make sure, though, that even though that the chamber is closed, we still will be allowing for public comment. So the form to submit public comment, that can be found on our website. Our website is council.nola.gov, and the agenda can also be found on our website. That agenda will be posted today. I also want to make very clear that all of these processes were developed in accordance with an Attorney General opinion, which he put out on March 18th, as to how public bodies are to proceed with public meetings during this COVID-19 emergency. The meeting can be seen live on our website. Once again, our website is council.nola.gov, and also on Cox Cable Channel 6 in Orleans Parish. So once again, I just want to make sure everyone understands that we will be accepting public comment on what is on our agenda, which will be released today, and all the forms can be found on council.nola.gov. So the New Orleans City Council, of course, is committed to keeping government running, but we want to do it safely, and we want to continue to encourage everyone to stay at home. Thank you so much.
Thank you, Councilwoman Moreno. One thing about it, as she mentioned, city government is still running and operating, and going to having meetings remotely is the new normal, and it is imperative so that we can keep the business going. We have recently stood up meetings. The Architecture Review Committee recently met. So we're moving those along through VCC, HDLC, and the like. Also, we are having our public engagement, our community engagement meetings as relates to infrastructure projects that we are moving forward with in the city of New Orleans. Last night, I think we had St. Claude. We had a community meeting via WebEx. We had over 40 participants, which was a big deal because in a usual setting in the neighborhood, we may get about 7 to 8 depending on the matter. But an increase of 40 is a big deal, so we're just seeing, in terms of engagement, that's happening, and it will continue to be a top priority for us. I've instructed my staff to now have all these groundbreakings and even some ribbon cuttings that have been piling up, and I said to them, look, let's do them virtually, because we need to show the people that we're doing what we say and we're getting your business done. So with that, we're going to move to questions and answers at this time.
Thank you, Madam Mayor. Jambalaya News.
I have two questions. The one is, we receive a lot of complaints about churches in New Orleans East. Pastors calling people, members, for weekend services. Mm-hmm. They say it's only 10 or 12 people. We say they can do that, but it's still working.
We say no. We say no, meaning the city of New Orleans and all of our officials, our public safety team, from chief of police, fire, EMS, Homeland Security, Dr. Vagno, our city council officials, mayor of the city of New Orleans. It's not tolerated, unfortunately. And we understand that this is a huge sacrifice, but it will be a sacrifice worth it for everybody. And that's a part of why we touched it in this press conference, kind of holding it until Thursday, today, to speak towards the upcoming weekend. But we cannot support this type of activity, and we apologize, but it cannot happen.
I have second question for Dr. Begno. People need to know exactly when people with COVID-19, it's okay, it's free, it's healthy, because it's many confusion about that, because some people they don't have the symptoms like respiration or fever or something like that. They need to know exactly how they can determine when they are free.
Sure, and we'll have Dr. Vagno speak on that. And what we have seen, even as it relates to, our department's public safety team, for example, where we've had, officers that have had COVID or have been on quarantine that have now returned back, over 56 of them, also with fire. So we understand not only the question, but how it can be confusing. So Dr. Bagno?
Yes, thank you. It is confusing, and the guidance has changed in the few weeks that we've been doing this. But what we're putting out, and again, this is based on CDC guidance, and we're doing this with all the best practice that we can. If you have tested positive, if you know you have a positive COVID test, the recommendation is you have to stay home for at least a week, and you have to be at least 3 days with no symptoms. So you're feeling 100% back to normal, no fever, no cough, no anything else. If you're someone who sort of felt bad but didn't get a test, you should assume that you had it. And in that case, we're saying 2 weeks since your symptoms first started, since we don't know, whether you were positive or not, but the day your symptoms, whatever your symptoms were, if they were cough, if they were fever, if they were fatigue, feeling, that you couldn't smell, then we're saying wait 2 weeks. As long as you are back to normal, you can do your, again, still stay home, but do your essential activities. We are strongly discouraging employers from asking employees to provide proof of a test or a return to work note. We do not recommend that. That is an overburdening of our healthcare system. It's not necessary for individuals. Again, this is based on federal guidance. So again, just employers, it is not necessary for folks to disclose to you their test results or provide a note to return to work.
And Dr. Begno, talk just a little about our efforts preparing for antibody testing.
Sure. So you probably heard that there are tests that can determine whether you have antibodies to COVID. So the test we have now just shows if you are infected at that time. What an antibody test shows is if you've had the disease, it will remain in your system forever. And this is the basis of a lot of our of tests for other diseases. So if you were sick, you're feeling well now, and you had an antibody test that could say, yes, you've had COVID, but you're back to normal, so you are likely immune. This test, we believe, across the world is going to be really important to help us understand who is safe to go back to work when we begin to talk about a phased recovery. To my knowledge, there are 1 or 2 of these tests that just received FDA approval this week, which means that no one has them, and everybody wants them. I've had multiple discussions with the state and with our local healthcare institutions. They are all either in discussions about which test might be the right one, how to deploy them, whether or not, I'm told there are some researchers at LSU who might be working on one themselves. So we are tracking this very closely. Councilmember Moreno also has been very interested in looking into this. These will be a part of our recovery, but we also want to make sure that they are reliable and that we can rapidly deploy them to those who need them first.
Yep.
CNN.
Do we have CNN?
Hey, Mayor. We're wondering if you've received any refrigeration units from the state, and if so, how many?
Yes. We made the request to the federal government through the state of Louisiana. We made a request for 20 with the expectation of morgue space being needed for our neighboring parishes, particularly those that make up Region 1. We have stored the refrigerators at NASA Mishu temporarily, and we have actually shifted into creating a temporary morgue adjacent to our coroner's office here in New Orleans off of Earhart. We're working with an adjacent owner there who is providing space on his property for the refrigerators to set up, again, a temporary morgue. We are also working with that owner to erect privacy fencing so that we can be, of course, as respectful, as needed when it comes to caring for the dead. We have shifted to working with our surrounding one of the hospitals and different mortuaries that hold death care task force that I stood up several weeks ago, working with them to allow the coroner's office to kind of alleviate the burden that they're experiencing because of a lack of capacity. So that's happening, and I'll ask Colin to come up and just share a little bit more with you, because he's been front and center on this for the administration through Homeland Security. Colin?
So the mayor pretty much covered it, but I'll just fill in some details, because this is real and it needs to be out there, and it's going to be a reality that we're going to face. We requested through the state for 20 refrigerated trucks. 10 of those are now currently on site next to the Orleans Parish Coroner's Office. The Coroner's Office itself has 2 trucks, and the city rented an additional 2 right in the beginning stages of this. So that's a total of 14 refrigerated trailers that are on that site. We have erected privacy fence, privacy barrier around that area. We have also light towers and cameras there. We're working with the state, and they are, through the Department of Health, identifying the assets and resources needed to run that facility, and that will be done through the weekend. Additionally, we have staged 10 trucks in New Orleans, in New Orleans East. Those can be dual purpose, either a backup facility, should it be needed, or working with the state and our regional partners. And I have to say, the Orleans Parish Coroner's Office, we've been working with them obviously very closely, but also Jefferson Parish. Dr. Stanovich learned far more about this than I ever thought I would. It's a reality. We've been through it before, and there were some serious lessons learned from that, which I believe will put us in a better place this time dealing with this. And it's not the same circumstance as Katrina. This is an issue of a lack of storage capacity under very unique circumstances. Those additional 10 trucks that are out in New Orleans East, we will maintain them. They will be able to be moved or staged with other coroner's offices, potentially medical facilities if needed, or anyone in the region or state as far as we know right now. So it's really a partnership between the local coroner's offices, the death care community, the hospitals, and the state of Louisiana in particular. Has been real. As soon as we started requesting this, they were on it, and that's what I'll say about it. And I would ask that you'll see the activity around the coroner's office. I would ask people to respect the dignity and privacy of the people that are, in a very difficult time.
And just to clarify, yes, when we said New Orleans East, is that our training academy that we have there for the New Orleans Police Department. And again, they're staged there. So with that, next question.
Madam Mayor, the advocate.
I wonder if y'all can provide more information about how the mobile testing will work, and was the end of the drive-through testing solely because of the end of the federal resources, or were there other factors involved there?
Yeah, most in regards to the drive-up testing is that we had reached pretty much, we weren't getting, the population, the numbers, they were just diminishing. When we first started, we were, cranking out up to 300 at each site. Then we went down to one site and we're at 50. We're seeing like 50 people. And so we want to pivot our outreach to be more intentional about, again, meeting people where they are, looking at more closely in terms of hotspots that we may have identified, where we want to go where people are. The federal government considered our testing sites, our pilot being one of the best that they deployed nationally. We were the first to stand it up. It took us 3 days to do that. And they had actually made an additional commitment to provide us with additional testing kits to continue to run that operation. I'll ask for Dr. Vegno. You can speak more about the drive-through, not the drive-through, what did he say? Mobile.
And I just want to be clear that several of the federal pilot sites are also ramping down. Philadelphia is doing it as well, and several others. We were told by the federal government that April 10th was the day that they were going to remove their presence. And so they asked us all for a transition plan. And as the mayor said, we really do want to get kits and tests efficiently into the hands of where they are most needed. While we consider the drive-thrus to be an incredible success, I think you've all heard me talk about our frustrations with the commercial lab and the length of time that it's taken for folks to get results. And so we have some better options now that we'd rather support. In terms of the mobile testing, I don't have specifics for you. There's again, healthcare institutions have a few different ways that we're looking at doing this. So I don't want to give you too much, but what I will say is that looking at our drive-through testing data, we've been able to see those areas where very few people have come and got a drive-through test. So what that tells us is they either don't have transportation, or it wasn't convenient, or there's something missing there, and they're not able to access that service. So we're in the process right now of identifying those bare spots, B-A-R-E, and saying we need to find a way to be in this neighborhood and get tests to these residents because they weren't able to access the program that we had. So I'm hoping early next week, middle of next week, we'll have a lot more details on what that would look like.
Dr. Beckno, you want to share information of our testing for first responders, health workers through Oshner?
Yeah, Oshner reached out to us earlier this week or before and offered to provide some rapid testing for our first responders. I know Tulane had done that as well. And so starting today or yesterday, we've been able to identify first responders who are symptomatic, who are able to access one of the Oshner testing sites and get a turnaround within 24 hours. This is huge because, as you've heard, we've had a lot of our first responders become exposed or symptomatic, and it's taken a long time for them to get their results. And so the ability to get them the peace of mind, number one, get them back to work much more quickly has been great. So that's just another example of how our healthcare institutions are really stepping up and being flexible and responding to the needs of the city.
Thank you. Foxy?
2 questions, Madam Mayor. Last night, police responded in Bayou St. John's. People gathered along the bayou, and even across the street, there's a police presence as people are kind of gathered in the park. We're going into a holiday weekend. It's beautiful outside. Does the city plan to continue stepping up law enforcement?
Oh, absolutely. Oh, yeah. We're not letting up because it's not a time. We cannot let up. The future of our people depends upon it. And so we will be absolutely, remaining aggressive as it relates to enforcement, constitutional policing practices all the time, epic, that's ethical policing. So we will be doing that, but we will be aggressive, and it's important. But what we do find, and this is the beauty in this, when the police do have to respond, and we have seen numbers kind of going down, meaning in the amount of calls that we are receiving through 311 about these gatherings. So we're seeing a decline in the calls, which is a good thing. But when the police have to respond, and they do, we see that they are met not with frustration. People disband accordingly, and that's the best thing that we hope for. One, we hope that you just do the right thing and take the burden off of our police department to have to respond, to gatherings. But when they do, how you meet them with respect, it does matter, and that's what we've been seeing. But let me tell you, you're making me think about something that one of our students, I believe, at Tulane experienced on yesterday. You guys can get me straight on this. But discrimination is something we will not tolerate in the city of New Orleans. We are a welcoming community, always have been, always will be. And we had one of our Asian residents approached with a gun, and someone asking him if he was Chinese or Vietnamese. That's unacceptable. He's a human being. And this virus doesn't discriminate. And the city of New Orleans will not at all, and we will not tolerate that. I just had to touch that. And then let me add this, and this is I was on a little call earlier with Barack Obama, and and some of the messages that he was sharing. And one was that take care of your most vulnerable people. You will not go wrong. And even as relates to health disparities and the impact on the African American community, going even a little bit further as it talks about our vulnerable population, that's our street homeless as well. So what we will not also tolerate in the city of New Orleans is the thought of not in my backyard. These are all of our people, and we will take care of our people and our most vulnerable. So I was proud to hear him say that, because it just reinforced for me that we're doing the right thing as a city. And I had to field some calls by some residents kind of upset that our homeless are near them. But they are our people, and we have them located in the CBD, in Algiers, and in New Orleans East. Everyone matters, and we will protect all of our folks the best that we can. And that's why I'm focusing on now I believe about 147 it shifts as relates to that number of our people who are still on the street. And that remains a priority for me and my administration, to get them off of the street. And so thank you for your question. Latanya?
Sorry, one
Oh,
last
yeah,
question.
I'm sorry.
No, it's
I
okay.
went all around the world.
There's been complaints about people discarding gloves and other sanitation equipment around the city, especially in grocery store parking lots. Has there been any talk about that sort of careless disposal?
You meaning discarding, throwing away? Well, first of all, we need to use our protective equipment and be responsible with its use. There's a lot of effort that has gone out to get our hands on PPE, whether that's effort, of course, from the administration, from the New Orleans City Council, our partners that we've seen from across the country. We have to be responsible and show that we're appreciative of the PPE, because it is being provided to protect everyone. So if you have it, use it, and use it the right way. But no one, I don't care if it's PPE or what, no one should be littering the streets of the city of New Orleans. Now, I don't know about you, but I've seen things a little bit cleaner. The administration was still hard at work. Fewer people on the street. But when I still see trash on the street, I'm like, come on, people. We can do better. We can do better. So please do not litter the city that you love. And this is a real opportunity to not only clean our city up, but as we pivot and move towards recovery, that we come out of it with a cleaner city that we will keep clean. That's my goal.
WDSU?
I got three. The first one, yeah, I'll make it quick.
Make me feel like the governor around here. All these questions.
In regards to the Carnival cruise ship, the governor said yesterday that 300 of the crew members were released yesterday. Do we know how many are still on the cruise ship?
On the cruise ship right now, I know that those individuals who tested positive remain on the ship, on Valor. I do not know the exact number. I'm going to point to Colin to see if we have that exact number of who currently remains on the ship. Colin, you know?
Approximately 200 remain on the ship. 124 tested positive but are asymptomatic at this point. 12 have flu-like symptoms.
I missed all that.
WDSU?
And are you still experiencing a major backlog on test results?
We are. We have seen more come in, and that contributes to the number of increase in the results in terms of positive. We do feel like we know we still have a backlog, but Dr. Beckno, do you know that exact number now?
As of yesterday, I would estimate it to be about 1,500 results that we would expect to have by now, but don't. I know that there's more results that came in this morning that I haven't run the numbers yet. You know, with closing the site tomorrow, you know, it's my hope that that backlog will be relieved by next week.
Last one. Once this pandemic is over, or at least gets better enough for the city to start functioning again, what's the first step in attacking the $150 million in fiscal losses?
Oh, we're working on attacking that right now. That's why we're very much focused on it as a city, and I do believe one of the first cities in the country to take a real deeper dive into the CARES Act and determining what it really will mean to the city. As we have taken that closer look, we see that it will not, based on how it reads and how in our discussions at the state level, which will be ongoing, but based on the formula, that it will not cover the deficits that we have. And that's a big, big concern. It is, what we're told is that it will be based on the expenditures or the expenses that are aligned with COVID, and not so much the losses, right, to businesses, the losses to the city of New Orleans due to sales tax and the like. And so that's a major concern for the city at this time. If, you know, we can't fill that, you know, at least that 150 and upward deficit that we're seeing, and most of that, in an upward of 120 million, is really sales tax related, that's a big hit for the city of New Orleans, and it doesn't make me feel like we're cared about if that's all that's going to come from the federal government to the state of Louisiana and down to the city of New Orleans. But we are looking very closely at it, and we'll be advocating at every single level to ensure that the city of New Orleans gets her fair share, particularly, again, being ground zero for this virus and the financial impacts that it's having on our city.
WWL.
Sewage and Water Board Director Ghassan Korban said today he sees possible bankruptcy for the Sewage and Water Board as a result of this. Do you see that?
Potentially, potentially, and that speaks to really what the point I just made, to that formula, you know, that's been talked about, that will not be included in any type of stimulus relief on the ground to the city of New Orleans, which is a major concern. And you know how critical the services are as it relates to the Sewage and Water Board. And in 53 days, we're going to be in hurricane season, right? So those are things that we're thinking about and have been thinking about, but also not only in preparation for hurricane season, but with this high river, you know, that we have as well. But there's more to come on that, but understand we are very much focused on the impacts that it will have to the Sewage and Water Board and to the city of New Orleans.
Also, we're hearing some reports about churches doing drive-through services this weekend. Any thoughts on that?
We do not support drive-through services or communion. Again, we understand the sacrifice. The Lord understands as well, you know, and we have to do the right thing, stay the course, so that we don't have to worry about drive-through communion.
Also, just generally, it's been a month since the first case in Louisiana was reported. Just what are your thoughts about how fast things have changed?
Well, one of the things when we look at that March 9th date and looking at the data and doing the analysis of the data from March 9th to today, what it says is that based on the actions that the city of New Orleans that we took on that date proved to be the most effective, to where the city of New Orleans not only did the right thing, but we brought the state of Louisiana right along with us in doing the right thing. So we made the right call. And as we look at the data sets, we saved lives as well. And there's no doubt about it. So we'll continue on this path, and that's why we're encouraging and really with all of our force, with all of our might, encouraging our people to continue to stay at home.
Any other questions?
All right, y'all warm me out now. Well, thank you all so much, you know, for what you do on a daily basis and informing the public. and being responsible in your reporting. We appreciate that. Thank you.